Hey everyone, and welcome back to the Glow Channel. I'm your host, and I'm thrilled you're joining us today because we're about to embark on a fascinating exploration into a truly remarkable medical procedure. Welcome to our deep dive into bone grafting, a crucial procedure in modern medicine. This technique has revolutionized how we treat a wide range of bone-related issues, from complex fractures to preparing for dental implants. It's a cornerstone of reconstructive surgery, helping countless individuals regain function and improve their quality of life. We're going to break down what can often seem like a complicated topic into easily understandable parts so you can feel informed and empowered. Today we'll explore what bone grafting is, the different types available, the intricate science explaining how it works, the various situations and conditions when it's needed, and importantly, what you can realistically expect during the recovery process. We'll cover the A to Z, ensuring you get a complete picture. Think of this as your ultimate guide, designed to answer your questions and perhaps even alleviate some concerns you might have about bone grafting. Our goal is to demystify this procedure, highlighting both its innovative aspects and the practical considerations involved for patients and their families. Understanding bone grafting isn't just for medical professionals, it's for anyone who might encounter this procedure, either for themselves or a loved one, or even if you're just curious about the incredible capabilities of modern medicine. Knowledge is power, especially when it comes to your health. By the end of this video, you'll have a much clearer understanding of how surgeons can help bones heal and regenerate, often in ways that seem almost miraculous. So grab a notepad, get comfortable, and let's get started on this informative journey together. So let's start with the absolute basics. What exactly bone grafting? At its core, bone grafting involves the surgical placement of new bone, or a specialized bone substitute material, into spaces or defects within or around a bone. This might be a gap caused by a severe fracture, an area where bone has been lost due to disease, or a site that needs to be built up to support a future implant, like a dental implant. The primary purpose here is to repair and regenerate bone tissue that is damaged, missing, or otherwise insufficient. It's a constructive process aiming to restore the bone's natural form, strength, and function, allowing the body to effectively mend itself with a helping hand from medical science. This procedure is incredibly versatile and addresses a fundamental need in orthopedic and dental surgery. The real magic of a bone graft lies in its ability to stimulate and support the body's own bone growth mechanisms. Think of it as providing the ideal conditions for healing. The graft material can act as a biological scaffold, a framework upon which new bone cells can migrate, attach, and begin their work of rebuilding. It's not just about passively filling a void, it's an active process. This new bone or bone substitute encourages the surrounding tissues to get involved in the healing cascade. It's about creating an environment where your body's natural healing potential is maximized, guiding the bone to regenerate in a structured and effective manner, ultimately leading to a solid, integrated piece of bone where there was once a problem. Ultimately, bone grafting supports and enhances natural healing in situations where the body might struggle to do so on its own. For instance, some fractures are so complex, or the gap between bone ends is so large, that the body's intrinsic healing capacity is overwhelmed. Similarly, certain diseases or infections can lead to significant bone destruction that requires more than just time to heal. In these scenarios, a bone graft acts as a catalyst and a structural bridge, encouraging the ingrowth of blood vessels and new bone cells. It provides the necessary building blocks and signals to kickstart and sustain the regenerative process, ensuring that the bone not only heals, but heals strongly and correctly, restoring integrity to the skeletal system. Now that we know what bone grafting is, let's delve into the different types of materials that can be used. It's not a one-size-fits-all situation, and surgeons have several options. Broadly, we can categorize them into four main types: autografts, allografts, xenografts, and synthetic grafts. Each of these comes with its own unique set of sources, advantages, and, of course, potential disadvantages. The choice of graft type is a critical decision made by the surgeon based on the specific clinical scenario, the size and location of the defect, the patient's overall health, and the desired outcome of the procedure. Let's break these down one by one. First up is the autograft, which is often hailed as the gold standard in bone grafting. Why? Because an autograft uses the patient's bone. This bone is typically harvested from another site in the patient's body, such as the iliac crest, the large bone of the pelvis, a part of the fibula or tibia in the leg, or sometimes even from the jaw or skull. The major advantages here are significant because it's the patient's own tissue. It contains living bone cells, growth factors, and carries no risk of immune rejection or disease transmission from a donor. However, it's not without its downsides. Harvesting an autograft requires an additional surgical site, which means a second incision, potential for pain, longer surgery time, and a limited supply of available bone. Next, we have allografts. An allograft is bone tissue that comes from a human donor, typically a deceased individual who has donated their tissue to a bone bank. This bone is rigorously screened for diseases, sterilized and processed to remove cells, which helps reduce the risk of an immune response. The big advantages of allografts are their ready availability in various shapes and sizes, and the fact that they eliminate the need for a second surgical site on the patient, thereby avoiding donor site morbidity. However, while processing minimizes risks, there's a very small theoretical chance of disease transmission. Also, because the cells are removed, allografts may integrate more slowly than autografts and lack the live cell component that autografts offer. Then there are xenografts, which are bone grafts sourced from a different species, most commonly bovine cow or porcine pig bone. This bone is specially processed to remove all organic and immunogenic material, leaving behind the mineral scaffold. Xenografts offer good availability but can have a higher potential for immune response or slower integration compared to human bone, though modern processing techniques have greatly improved their safety and efficacy. Finally, we have synthetic grafts. As the name suggests, these are man-made materials designed to mimic the properties of natural bone. They are often composed of biocompatible ceramics like calcium phosphates, such as tricalcium phosphate or hydroxyapatite, bioglass or sometimes polymers. The key advantages of synthetic grafts include an unlimited supply, no risk of disease transmission or immune rejection, and the ability to be manufactured with specific porosity and resorption characteristics. They can be designed to be osteoconductive, providing that crucial scaffold. However, many synthetic grafts lack the osteoinductive, growth-stimulating or osteogenic, cell-providing properties of autografts, and their resorption rates can sometimes be unpredictable. The ongoing research in this field is constantly leading to new and improved synthetic options that aim to combine the best of all worlds. So we've talked about what bone grafts are and the different types, but how exactly do they work their magic at a biological level? It's a fascinating interplay of different mechanisms, often described by three key properties: osteoconduction, osteoinduction, and osteogenesis. Let's start with osteoconduction. This essentially means that the bone graft material acts as a scaffold or a framework. Imagine a trellis for a climbing plant. The trellis doesn't make the plant grow, but it provides a structure for the plant to climb and spread along. Similarly, an osteoconductive graft material provides a passive, porous structure that allows blood vessels and new bone cells from the patient's surrounding healthy bone to migrate into the defect site. This scaffold guides the new bone formation, ensuring it fills the gap in an organized way. Next up is osteoinduction. This is a more active process where the graft material actually stimulates the formation of new bone. It does this by containing or releasing specific proteins, often called growth factors, like bone morphogenetic proteins, BMPs. These growth factors act as powerful signaling molecules. They recruit undifferentiated mesenchymal stem cells. These are like blank slate cells present in the surrounding tissues and effectively instruct them to transform into osteoblasts, which are the specialized cells responsible for building new bone. So osteoinduction is like sending out a chemical call to action, actively encouraging the body's own repair machinery to kick into high gear and start producing bone where it's needed. Not all graft materials are inherently osteoinductive, but some, like autografts and certain allografts or synthetics with added growth factors, possess this crucial property. The third key property, primarily found in autografts, is osteogenesis. This refers to the direct contribution of living, bone-forming cells from the graft itself. Because an autograft is harvested from the patient's own body, it comes complete with viable osteoblasts, osteocytes, mature bone cells, and osteoprogenitor cells, cells that can become osteoblasts. These cells are essentially transplanted to the defect site and can immediately begin the process of laying down new bone matrix. This gives the healing process a significant head start, as it doesn't solely rely on cells migrating in from elsewhere or being induced to form. It's like bringing your own construction crew directly to the building site, ready to work. This unique combination of osteoconduction, osteoinduction, and osteogenesis is why autografts are often considered the most effective type of bone graft, despite the drawbacks of harvesting. Now that we understand the what and how, let's talk about the when. When is bone grafting actually necessary? This procedure plays a vital role in a surprisingly wide array of medical and dental situations. One very common area is in dental procedures. For instance, if you're getting a dental implant to replace a missing tooth, there needs to be sufficient jawbone to support it. Often, after a tooth is lost, the bone in that area can shrink or resorb over time. A bone graft can be used to rebuild this bone, creating a solid foundation for the implant. It's also used in treating advanced periodontal disease that's led to bone loss around teeth, or in procedures like a sinus lift, where the sinus floor is gently raised and bone is added to the upper jaw to accommodate implants. Moving into the orthopedic realm, bone grafting is a cornerstone of many spinal fusion surgeries. Spinal fusion is performed to permanently connect two or more vertebrae in the spine, eliminating motion between them. This can be necessary for conditions like degenerative disc disease, scoliosis, spinal instability, or after a spinal fracture. The bone graft material is placed between the vertebrae, and over time it fuses them into a single solid bone, providing stability and often relieving pain. Another critical application is for bone fractures that just don't heal properly. These are known as non-unions or delayed unions. Sometimes, despite standard treatment, a fracture fails to mend, and a bone graft can be the key to bridging the gap and stimulating the healing process that has stalled. Beyond these, bone grafting is indispensable for repairing significant bone loss that can occur due to various reasons. This includes traumatic injuries, where a segment of bone might be shattered or lost, or after the removal of bone tumors. Infections in the bone, known as osteomyelitis, can also destroy bone tissue, necessitating a graft to reconstruct the affected area once the infection is cleared. Congenital defects, where a person is born with a bone abnormality, may also require grafting procedures to correct the structure and improve function. Furthermore, bone grafts are frequently used in joint replacement revisions. When an artificial joint, like a hip or knee replacement, wears out or loosens over time, there can be bone loss around the implant. Before a new implant can be placed securely, a bone graft might be needed to restore the bone stock. So you, or someone you know, might need a bone graft. What does the actual procedure entail? While specifics can vary greatly depending on the location and type of graft, there's a general flow to most bone grafting surgeries. It all begins with thorough preparation. This includes preoperative assessments, which might involve blood tests, a review of your medical history, and detailed imaging studies like X-rays, Connecticut scans, or MRIs to precisely plan the surgery. Based on the extent of the procedure and your overall health, a decision will be made about anesthesia. This could be local anesthesia with sedation for smaller grafts, regional anesthesia, like an epidural for spinal procedures, or general anesthesia, where you're completely asleep. You'll also receive instructions about fasting before surgery and any medications you might need to stop or start. Once you're in the operating room and the anesthesia has taken effect, the surgical team gets to work. If an autograft is being used, the first step often involves harvesting the bone from the donor site. For example, if bone is taken from the iliac crest, a separate incision is made over that area, and the surgeon carefully exposes the bone and removes the required amount of graft material, which could be a solid piece or cancellous bone chips. This donor site is then meticulously closed. Simultaneously or subsequently, the recipient site, the area that needs the bone graft, is prepared. This involves making an incision, exposing the deficient bone, and carefully cleaning the area, removing any scar tissue, unhealthy bone, or debris to create a fresh bed for the graft. With the recipient site prepared and the graft material ready, the surgeon will then meticulously place and shape the graft to fit the defect perfectly. The goal is to ensure good contact between the graft and the host bone to facilitate integration. Often, the graft material needs to be stabilized to prevent it from moving, which could hinder healing. This stabilization can be achieved using various methods, such as small screws, plates, wires, or specialized membranes. Once the graft is securely in place, the surgeon will close the overlying soft tissues and skin with sutures or staples. A sterile dressing is applied, and in some cases a cast or splint might be used to further immobilize the area. The surgery is done, but what happens next? The recovery and healing phase after a bone graft is just as crucial as the procedure itself. Let's talk about what you can typically expect. In the initial period, usually the first 1 to 2 weeks, it's common to experience some swelling, bruising, and pain around both the graft site and the donor site if an autograft was used. Your medical team will provide strategies for managing this discomfort, which usually involves pain medication, applying ice packs to reduce swelling, and keeping the affected area elevated if possible. You'll also have instructions for wound care, keeping the incision sites clean and dry, and you'll be monitored for any early signs of complications like infection. The real work of bone integration, however, takes much longer. This is the process where the graft material gradually incorporates with your own bone, becoming a living, solid part of your skeleton. This biological process involves the ingrowth of new blood vessels into the graft, the formation of new bone by osteoblasts, and then the remodeling of this new bone over time to adapt to the stresses placed upon it. This integration phase can take anywhere from 3 to 9 months, or sometimes even longer, depending on several factors. These include the size and location of the graft, the type of graft material used, your overall health, age, and whether you smoke, as smoking significantly impairs healing. Regular follow-up appointments with your surgeon, often including X-rays or other imaging, will be necessary to monitor this healing progress. Physical therapy is often a very important component of recovery, especially if the bone graft was in a weight-bearing bone or near a joint, like in the leg, arm, or spine. Once the initial healing allows, a physical therapist will guide you through exercises designed to gradually restore strength, flexibility, range of motion, and ultimately function to the affected area. It's also important to be aware of potential risks, though they are generally not common. These can include infection at the surgical site, rejection or failure of the graft to integrate, nerve injury causing numbness or weakness, bleeding, and delayed healing or non-union. Adhering closely to all your surgeon's post-operative instructions, including activity restrictions, and attending all follow-up appointments is key to minimizing these risks and achieving the best possible outcome from your bone grafting procedure. And that's our comprehensive look at bone grafting. We've journeyed from the fundamental question of what it is, through the different types, the intricate science of how it works, the many scenarios where it's a game changer, the step-by-step procedure, and finally, what to expect during the crucial recovery phase. My hope is that this detailed exploration has shed light on this remarkable medical intervention and helped you feel more informed, whether you're considering this procedure, supporting someone who is, or simply expanding your medical knowledge. Thank you for joining us on this journey through bone grafting. It's truly a testament to the body's healing power when given the right support. We covered a lot of ground today, and I sincerely hope you found this information clear, useful, and empowering. If you found this information helpful, please don't forget to hit that like button. It really helps the channel. And if you haven't already, consider subscribing to Glow and clicking the notification bell so you don't miss out on our future deep dives into health and medical topics. And of course, share this video with others who might benefit from understanding bone grafting better. Spreading knowledge can make a real difference in people's health journeys. Remember, while this video provides a thorough overview, it's essential to discuss your specific situation and any questions you have with your own healthcare providers. They are your best resource for personalized medical advice. Our mission here at Glow is to help you navigate the complex world of health with clarity and confidence. Stay curious, ask questions, and most importantly, stay healthy and informed. We'll see you in the next video.